I've been on Chronicity for about 2.5 years, and it's helped better manage my CAH. So before Chronicity, I was constantly going back and forth to my endocrinologist, and it was really frustrating.
So even from before I went to medical school, all doctors have been able to treat CAH with is steroids. And as you know, oftentimes in CAH, you need high doses of steroids to get the ACTH and androgen levels low enough. As you know, the high-dose steroids are associated with so many side effects, such as low bone density and high blood pressure and high cholesterol. Even with high-dose steroids, though, lots of times we would still have issues with high ACTH and androgen levels. And as you experienced, doctors were just playing catch up all the time, having to increase the steroids. The androgens were high.
But how is Chronicity different?
So Chronicity is actually a non-glucocorticoid, a non-steroid. It's the first non-steroid medicine we've been able to use. Chronicity works by impacting the HPA axis. It decreases those ACTH levels, and then that leads to decreased androgen levels from the adrenal glands.
Could you explain to me again what the HPA axis is?
Sure. So the hypothalamic pituitary adrenal axis makes a lot of hormones that are like signals that tell your body how to deal with stress and growth and that sort of thing.
Okay, that makes sense. Could you explain to me how Chronicity works, the HPA axis?
Absolutely. So as you can see here, the hypothalamus is supposed to send the signal CRF to the pituitary, where it binds like a lock and key to its receptor of CRF1. How Chronicity works is that it binds to CRF1 and it prevents CRF from binding to its receptor. And by doing that, it prevents the pituitary from sending all this ACTH out throughout the body.
So how does that lower my androgen levels?
So ACTH is like the on switch for your adrenals. And your adrenals, in patients with CAH, they're supposed to make cortisol and androgens. But because of the problem with the enzyme that makes cortisol, you can't make cortisol. So instead, you just make all these excess androgens. By decreasing the amount of ACTH in the body, Chronicity decreases the on signal to the adrenal glands. So you end up making a lot fewer androgens.
Now I understand. And Chronicity provides a different way to manage androgen levels to allow lower doses of steroids.
Absolutely. Chronicity is the first FDA-approved non-steroid treatment for CAH that decreases the production of ACTH, the signal that leads to excess androgens.
Important safety information. Approved uses. Chronicity crinecerfont is a prescription medicine used together with glucocorticoids, steroids, to control androgen, testosterone-like hormone levels in adults and children 4 years of age and older with classic congenital adrenal hyperplasia, CAH. Important safety information. Do not take Chronicity if you are allergic to crinecerfont or any of the ingredients in Chronicity. Chronicity may cause serious side effects, including allergic reactions. Symptoms of an allergic reaction include tightness of the throat, trouble breathing or swallowing, swelling of the lips, tongue, or face, and rash. If you have an allergic reaction to Chronicity, get emergency medical help right away and stop taking Chronicity. Risk of sudden adrenal insufficiency or adrenal crisis with too little glucocorticoid steroid medicine. Sudden adrenal insufficiency or adrenal crisis can happen in people with congenital adrenal hyperplasia who are not taking enough glucocorticoid steroid medicine. You should continue taking your glucocorticoid steroid medicine during treatment with Chronicity. Certain conditions such as infection, severe injury, or shock may increase your risk for sudden adrenal insufficiency or adrenal crisis. Tell your healthcare provider if you get a severe injury, infection, illness, or have planned surgery during treatment. Your healthcare provider may need to change your dose of glucocorticoid steroid medicine. Before taking Crenessity, tell your healthcare provider about all of your medical conditions, including if you are pregnant or plan to become pregnant, or are breastfeeding or plan to breastfeed. Tell your healthcare provider about all the medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. The most common side effects of Crenessity in adults include tiredness, headache, dizziness, joint pain, back pain, decreased appetite, and muscle pain. The most common side effects of Crenessity in children include headache, stomach pain, tiredness, nasal congestion, and nosebleeds. These are not all the possible side effects of Crenessity. Call your healthcare provider for medical advice about side effects. You are encouraged to report negative side effects of prescription drugs to the FDA. Visit MedWatch at www.fda.gov/MedWatch or call 1-800-FDA-1088. Dosage forms and strengths. Crenessity is available in 50 milligram and 100 milligram capsules and as an oral solution of 50 milligrams per milliliter. Please see the accompanying full prescribing information or find it at www.neurocrine.com/CrenessityPPI.